Hello, everybody. As you know, navigating through all of these health orders in the last several months has been nothing short of a roller coaster for contractors. It can be a difficult moment, especially for LBEs. So we're here to help as best we can. It's new for everyone, so in some respects we're navigating just in the same way. We're still trying to figure things out as we go along. With every set of health orders that come out, a lot of times those health orders change drastically from the health orders that were just issued days or weeks prior. So I'm going to get into a presentation here. We got quite a bit of stuff to cover. So when you're opening up your job site, I know that there's going to be some of you out there that are currently working. I know that there's going to be some of you out there that are trying to figure out how to start your job sites. The first things that you're going to have to think about is your site-specific safety plan, your health and safety addendum that has all of the COVID-19 protocols involved. The other thing that is really important in the new health order mandates is to assign a company COVID-19 safety compliance officer. And no matter if you're considered large construction or small construction, you have to have a safety compliance officer. We're going to touch base on that a little bit later. Training is very important on all this. Your signage that needs to be throughout your job site, you need to make sure that that is posted in all relevant languages, because you can run into some issues there, of course. The entrance screening that should be done now comparatively to what a job site was like before is an extremely important aspect of opening a job site and taking precautions with COVID-19. And, there's going to be best practices. There's going to be moments that you're going to rise above what Cal OSHA wants and above what the city and county may want. When you're talking about signage and postings, you're going to have an entrance, you're going to have a checkpoint at your job site, and you need to make sure that you have all the entrance and exits and bathrooms. Anywhere that someone is washing their hands, you have these COVID-19 protocols about social distancing, about sanitizing, about hand washing, and make sure you have that in relevant languages, of course. Now, here's a couple examples. This is on one of our job sites that we're a part of out at San Francisco International Airport, and the safety manager Skanska was very happy to share these, and I thought these were really good. Skanska made these up themselves, but as you can see, there is like a 4 basic question that is going to be at the entrances of these job sites, and it's the same throughout the industry. This is what contractors are focusing on, is if you have been diagnosed positive with COVID-19, if you had anyone in the household, who had COVID-19, if anyone in your home currently is quarantined for COVID-19, have you or anyone in your household traveled internationally in the past 14 days, and are you exhibiting any type of symptoms? And we'll get into the symptoms later. I'm sure you guys have been hit hard with all of the COVID-19 symptoms. So these 2 pictures are great because these are 2 different job sites, and they post these right at the entrance. You literally get at, this is both outside too, which, there's indoor moments too, but outside, before you can even get towards the job site, before you can even get to the checkpoint station, they're posting signage and hand washing and hand sanitizing stations. Now, I know that job sites can be tricky. Sometimes they're tiny. People are working on top of each other. They're indoors. Not always going to be an outdoor moment. But this is a really good example of when you walk up to a job site, what the worker would see and what he's directed to do. And then after this signage, you get into a social distancing line and you get into the checkpoint. And at the end of that checkpoint, you would see something like this. There's going to be a worker there. That might be the safety compliance officer, or it might just be someone who's assigned to be the person at the checkpoint. It can be a laborer, it can be anyone. That person takes all of the relevant information for the log that you need to keep, and your safety compliance officer needs to keep to be able to track anyone on your job site in the event that you had a positive COVID-19 case. I mean, heaven forbid, but it has happened at our job sites, more than we like. And we've experienced, everything from, okay, let's track the last 14 days of this worker. Let's find out what crews he was on, the locations. All of this becomes extremely important now, when before it wasn't that big of a deal. When we're talking about the job entrance screening, that picture is a really good example of one of our indoor jobs at San Francisco International Airport. And you walk up, there's a hand washing station right outside there and a hand sanitization station. And then when you walk up, there's a piece of erected plexiglass in between you and the person that is doing the entrance screening. And what this particular company does is they have these little colored stickers that they put on people's hard hats with the date on it. So you know the day of the week and the date. And so while you're on the job site, you can keep track of if you have a lot of workers. Some companies only have a few workers, only have a few employees. That's fine. But if you have a little more than you can keep track of, a hard hat sticker is a really great way to know that that person checked in safely into your job site. The daily logs that you're going to have to keep track of and that your safety compliance officer needs to keep track of and have on hand at any time is very important. And that's the worker's information, that's their address, their numbers, the time frames, where they're working on the job site. Obviously, social distancing is important. I was talking about the colored hard hat sticker for the identification. Some companies are doing a wristband as well with the information of that day, or a colored wristband. I'm not a huge fan of that because you end up having to touch. Then you're reaching out, and there's something that transfers there. It's a little bit easier to do a little small sticker and put it on your hard hat. It's a little bit less of a interaction there. When I say hand washing and sanitization stations, if possible, it's not always going to be possible, which you need to make sure that you have it available for your workers. And that might be something where it's on their person. You might have individual workers have what they need to keep clean and keep sanitized during the day. Social distancing and hand washing sanitization signage, that also these are the biggest spots that all your signage needs to be. And if you're on a job site that has stair scaffolding or different types of entrances and exits, make sure that is posted, everywhere, because it's really important. So keeping workers and visitors safe on the job sites, training is always the number one thing. As employers and as the owner of these companies, it's your responsibility to make sure that your workers are trained, but also that you have any visitors or special inspectors. You may potentially have people on your job site during this COVID-19 pandemic that they're not employed by you. So that's where training comes in with your employees. That's where that job site entrance becomes extremely important. The 6-foot rule is a social distancing rule. You want to make sure that your workers are wearing face masks, that they're proper non-medical face coverings. You can get into a little bit of hot water if you have face masks that have the vents on them. And I'm talking about the ones that you buy, on any website, and they have like a couple of vents that aren't filtered. People are like, oh, I love these vents because I can breathe better. And, sometimes they have filters inside those little vents, and you can just take the filter out. And then it's just like not wearing a mask at all. So that is frowned upon in the city of San Francisco heavily. So just make sure that you've got a simple fabric mask that is breathable, and make sure you supply that to your workers. Additional PPE, if sometimes you find your workers, they're just in a position where they have to work fairly close to each other, and you're worried about that type of contact, you're worried about them being too close to each other and breathing that air. A lot of solutions can be a larger plastic face shield while they have to do that work. If you want to go the route of respirators, your workers have to be trained with those respirators, and they also have to be fit tested. They can't just be like me with a big hairy beard and throw a respirator on and you're good to go and you send them out in the field. You know, you can get in trouble that way, and you can also be held liable. So with barriers, you know, as well, I've seen some really innovative best practices with barriers where I've seen electricians lined up and they all had to be, you know, stuck together in this small space. And, you know, a little wood barrier, a little plexiglass barrier was put up in between, and it really gave the workers some peace of mind. And of course, they were wearing all the other PPE, but these are all just some ideas. Now, most larger construction companies require 100% PPE all the time. And, you know, throughout the time that I've worked with LBE contractors, some LBE contractors, you know, they're like, hey, that's not required by OSHA. We don't have to have these guys wear this, that, and the other. I highly recommend making a gloves policy for your construction company and for you as a contractor, because if you can get these guys to wear gloves 100% of the time, it's just a built-in extra form of PPE that could help save lives in the end, and it could also help save their digits. Proper hygiene, you know, you can't replace hand washing. You just can't replace it. You can use hand sanitizer is an excellent additional moment, but training your workers to wash their hands frequently and making hand washing stations available to them is huge. And with this COVID-19, you know, pandemic, I've seen construction companies add as much as 3 or 4 hand stations around the job site where normally there was only 1 at the bathrooms. You know, they'd have 1 at the entrance, you know, 2 on either side of the job site, 1 near the bathrooms, and make sure there's, you know, 2 hand washing stations at the bathrooms instead of 1, and then to make sure that your workers, you know, have hand sanitizer. And if you're using hand sanitizer, please be very aware that it has to be at least 60% isopropyl alcohol to kill COVID-19. There are hand sanitizers that are out there that are for sale that are cheaper that don't have as much alcohol in them. What we do for our construction safety manager crews with Merriwether when we're out and about, we have hand sanitizer, and we also keep a small spray bottle of isopropyl alcohol to sanitize things quickly, whether it be your gloves, your hard hat, your boots, you know, before you get back into your truck and you go to another job site and potentially take something with you. A little quick spray bottle of you know, ammonia-based, alcohol-based, bleach-based. This all kills COVID-19, and it's just an added extra step that you can take. Workers' mental health is an extremely important moment during COVID-19. COVID-19 has put an added level of stress and anxiety on your workers, and because all construction here is you know, considered essential, you know, you're like, hey, let's get to work, fellas. And it's so important as the controlling contractor, as the owner of your company, to create that safe environment, because it's not just about the physical things, and it's not just about, you know, I have hand sanitizer, here you go get to work. You also want to make sure that your guys are in a good mental state and their morale is up, and they're not fearful at work, and that they're being honest with you if you're asking them questions about, hey, what could we do better? You know, do they have the right training? A lot of guys just want to work and they don't want to cause any problems, and you know, it's up to you to kind of navigate that a little bit. COVID-19 cases and other incidents. Now, this is something that I just recently put in these slides because what I am noticing and what my friends in this who are in safety are noticing, and we've been talking about, and this is mainly in the last, like, I would say month for me personally, we've noticed an uptick in other incidents on the job site during COVID-19. And it's not because workers are inherently just wanting to be unsafe. What we think it is that their mind is in another place, and there's a lot more stress and anxiety going on with the COVID-19 moment. So you're getting guys up there, and we just had a very terrible incident happen, not on any of our job sites. I just read this, but this was in Los Angeles, and there's a stadium being built, and a gentleman fell 110 feet to his death. Now this gentleman was wearing a harness, but he didn't clip off. So, you know, if he's up at that type of height and his mind is so distracted, You really want to think about that with your workers and make sure that you know, the eyes on the prize and that everybody is focused, and you're having really good meetings and daily briefings with them, and your orientation is covering these moments. So I wanted to make sure I brought that up because I think it's a very important thing to touch base on. Bathrooms and wash stations, of course, clean and well stocked. On average, we're seeing on job sites, the larger job sites, they're having crews clean those twice a day. You know, highly recommend bare minimum once a day, but if you could swing twice a day, I know people always don't always have the personnel for that, but shared tools and equipment. So this is another example of when that spray bottle of alcohol, that spray bottle of that bleach cleaner, I see them hanging on scissor lifts now. You know, just you walk up to the scissor lift, you grab the spray bottle, you hit the controls, anything that you're going to be touching, you feel a little bit better about getting in the scissor lift after the 6 guys that just used it for the last 4 hours got out of it. It's the same thing with shared tools. As much as you possibly can, try to avoid sharing tools. But if you have to share tools, make some type of sanitization available for your workers. And it can be very simple and very cheap. I mean, bleach and water at the right proportions kills COVID-19 on contact. So, you know, having that available on your job sites is really important. You know, break areas used to be, you could just have a little break area set aside with a tables and everyone could just crowd right into it. Now we're in a different boat. You need to make sure these guys are social distancing, and a lot of these guys are really great friends. They've been friends for years sometimes on your job sites. And workers want to hang out at lunch. They want to hang out and get closer, and hey, you know, you want to bite of my this or whatever. It's something that we've really had to crack down on at SFO is, you know, everyone's social distancing when working, and then, you know, you guys are sitting on the end of the tailgate you know, for lunch. So, so make sure that there's no shared water dispensers. You don't have a microwave out there for everybody to use. You don't have one little table sitting there that you say that's your break area over there. But, you know, if it's outside, inside, you need to provide that shade as well for these guys. And it has to be social distance at this point. Staggered work shifts is another way that you can, you know, eliminate a crowded job site. You have guys come in at different times, stagger your shifts, and I see a lot of companies moving towards this. And it's a more difficult moment, but you know, the alternative can be dire. Toolbox talks. Just remember that every morning you guys should be having daily briefings with, and COVID-19 needs to be included in these daily briefings, and that's, you know, that's mandated. So your toolbox talks aren't just about ladder safety or fall protection anymore. You know, it's really important that COVID-19 makes it into every aspect. So here's a couple of pictures of some guys, and you know, the guys on the ladder and in the lift. You know, excellent social distancing, excellent PPE, and believe it or not, in that area there was about 30 employees. And all of these guys were figuring out a way to be safe around each other. And then the guys on the stairwell, you know, purposefully both went to the stairwell at the same time. One of them took back a little bit, hung back. Those guys, excellent PPE, face shields, the whole thing, you know, and those guys are going up to work on something in fairly close proximity together. But while they're cruising up to that spot, you know, they're practicing excellent social distancing. Exposure, symptoms, and reporting. As a contractor, you need to have a COVID-19 action plan. So if something comes up, if heaven forbid somebody gets diagnosed with positive COVID-19 on your job site, you need to make sure that you have an action plan that's outlined. You know, we're talking about COVID-19 symptoms in a second here, but to be able to track your employees' job site movement for the last 14 days is very important. And that's, you know, if you're first starting out in your job, it's difficult. But once the job gets rolling, if anything was to come up, that is when you go and hit up your safety compliance officer and say, hey, let's take a look at those logs from the entrance, you know, job site tracking, and let's find out exactly where Tony has been this entire time, because, you know, how many people did he potentially expose? Where was he working? What surfaces was he touching? And of course, if you have any other subcontractors and other employees on site, including, you know, including the controlling contractor, whether that be a public entity or an actual construction company, they need to be notified immediately. So with Cal OSHA record keeping for COVID-19 cases, if COVID-19 was contracted on your job, it is recordable. And it needs to be logged in your OSHA 300 log, just like you would if you had any other type of recordable. A little bit later, Ingrid is going to talk about workers' compensation with COVID-19. But if something does come up and you have a positive case or multiple positive cases at once, which is what we've seen a few times on our job sites, that job site has to be shut down immediately. And you have to either bring in a third-party cleaning crew or you need to handle the cleaning. Now, the third-party cleaning crew is a preferred moment for a lot of contractors because you know, they're usually set up and ready to go and do it much quicker and better and faster. But that also is an extra added cost. So when you're disinfecting your job site, you need to pay close attention to hard surfaces. You need to know from your safety compliance officer and track where this crew has been, where each individual has been. And a lot of smaller job sites, they shut the whole job site down, disinfect the entire job site twice, and then you're ready to get back to work. But like at SFO, we have job sites that are massive and you have hundreds and hundreds of workers. So a lot of times they will close the area of the job site, you know, which will be maybe a quarter or a half of that job site will get closed, disinfected. And before your job site is reopening, you need to decide, you know, how you're going to communicate with your workers that it's safe for them to come back. Also, that it's safe for them to come back and they have a negative test result, because you either need to supply that test for them, you know, or in some cases, like in the city of San Francisco, if you live in San Francisco, you have free testing at our fingertips, which is great, but that not all cities and counties do that. So most construction companies that we're dealing with, it's required that the worker comes back. If they want to come back to work and they have their negative test result, that's the key factor. So I know you guys have heard this 100 times, but the COVID-19 symptoms, they've changed a little bit over the months. You know, there's some new strange ones that have popped up, but for the most part, this is what you see, and this is what you want to make sure that your guys are being honest about. You know, some guys, you know, they come to the job sites, check in, they got 5 kids, they're dying to work, they've been sick for 2 days, and they're just answering a questionnaire. You want to make sure that the attendant at your job site check-in is really also watching, making sure that someone doesn't look sick, isn't, you know, sweating or coughing or has COVID-19 symptoms. Yes, it might be a cold, but you know, if you have fever, chills, cough, shortness of breath, fatigue, muscle ache, headache, loss of taste or smell, I always thought that was a strange one, sore throat, congestion or runny nose, nausea, diarrhea, all of these can be an indicator. So we've had so many health orders, and I know you guys know it, and you've been reading them, and it's probably been a little bit tough to try to digest all of the health orders, let alone navigate the health orders. It would be a lot for us to just really run through the health orders. That's hours of running through stuff. So I'm going to try to go over them briefly, but please, you know, if you have any questions, you can also hit me up later via email. You can give questions to Ben. It's fine. We can get you taken care of. But navigating these new health orders is tough. We've had sets of them through March, April, and May, and at April 28th, I believe, that set of health orders, that is what designated small construction and large construction. So working for PUC or working for the city and county of San Francisco, this is all considered public works construction, so it's a little bit different. But they had very distinct differences between what was mandated between small and large construction. And like I said, you guys are most likely all public works construction, so you don't have to worry about some of that stuff. But let's take a look at the timeline here real quick. So you can see, even after this May 5th moment, there has been some more health orders issued, but they didn't really change the construction aspect of those health orders, only a little bit here or there, comparatively to, you know, the May 5th was more of the mandated and the rundown about public works projects, which is most of, like, all the projects that we work on at San Francisco International Airport, they're all public work. And the big difference is that, you know, instead of having the differentiation between the small construction, which is under 20,000 square feet, and the large construction over 20,000, and there's some other mandates in there between small and large. The difference is, the main difference for me, when I first read the health orders from April 29th, and I saw, you know, that they were requiring this JSAS person, a third party inspector on job sites, you know, it was a little bit like, oh boy, you know, this is serious business. And a lot of construction companies push back on that because, you know, they just couldn't do it. They couldn't afford to do it, or they didn't think it was very reasonable. So that did get a lot of pushback, but public works projects don't have that mandate. So health and safety plan compliance updates, you know, your health and safety plan addendum, it doesn't necessarily have to be your entire safety plan just gets thrown in the garbage and you have to redo everything with COVID-19 in every sentence. Really, it's just, you can follow what they're asking in the health orders, and you can create a health and safety plan COVID-19 addendum that is included with your current health and safety plan, if you have a health and safety plan, which you should if you've done any construction work, period. And all of these COVID-19 protocols, they need to be implemented into your daily work life. Every single job hazard analysis that you come up with for every task that you're doing on your job sites, every pre-task plan that your guys are coming up with and that you're coming up with, this all now has to have COVID-19 protocols in those JHAs and in those PTPs. And if those terms are new to you, we need to talk. Please hit me up, and you know, we can get a clearer picture about you know, when you do get on that job site, when you do need to you know, you have these 5 tasks that you're doing and these crews are doing this different thing, and you're like, I'm not quite understanding the approach with the JHA. I'm happy to help you on that front. If you don't have a job site orientation for your workers, you should think about putting one together. We can help you with that too. If you're a very, very small company, you know, it doesn't have to be anything super extravagant. You want it to be job site specific. You want it to cover basic health and safety for that specific job site. But now, of course, we have to throw in COVID-19. We have to have all of the new COVID-19 protocols that are required by your county and city inside that job site orientation. Larger construction companies, their job site orientations, they run an hour, hour and a half. You know, you're sitting in a room, used to be sitting in a room with, you know, a bunch of folks getting ready to go out on the job site. You'd have to get your job site orientation sticker. Well, a lot of times with smaller companies, you can do a scaled down version of that out in the field that is a verbal moment where you're including that in your daily check-in, you're including that in your, it's all wrapped up with your toolbox talks, and you're getting ready to get out on the job site, you're reviewing and getting your guys to sign that pre-tax plan that you're working on that day, or getting your guys to look over that job hazard analysis and know what the dangers are. Well, now those dangers include COVID-19. So having an orientation is always a good thing when you start a new job site. Even if you're a subcontractor, you can have a small orientation. And a lot of larger contractors will make all their subcontractors go through that orientation, as I'm sure you guys know. And you know, making sure that your workers fully understand all these COVID-19 revisions and plans and protocols. It's such an important moment. Let's get back to the safety compliance officer. So regardless, whether you're small construction, whether you're large construction, you know, whether you're a public entity, no matter what, you have to have a safety compliance officer. And that is someone that you, as the owner of your construction company, of your contractor, whatever your company is in construction, it's up to you to designate that person. And the qualifications are pretty minimal. It's a 30-hour OSHA construction safety. They have to have done that within the last couple of years. And first aid certification. Now, the first aid certification, very simple. There's classes you can take online that are extremely inexpensive. I think that the last one I did was in person, and it cost me, this was before COVID-19, I think it was like $35 or $40 or something. But the role of your safety compliance officer is kind of what we've been hammering this whole time during this presentation. It's really someone who takes control of how well your company is complying with all the COVID-19 protocols and mandates by the city and the county. And that safety compliance officer has to keep all those records. Now, you're keeping those records for a lot of reasons. Obviously, the main reason is if you have a COVID-19 case or cases that pop up, you need to access your records and see exactly, you know, where those or that employee has been that entire time, you know, for the last 2 weeks if needed. The daily briefings that are outlined in the health orders is basically like a toolbox talk. It's the safety compliance officer just giving a rundown to the workers in the mornings about, you know, okay, these are the things we need to practice, guys. Make sure you're wearing your mask, make sure you're social distancing, make sure you're cleaning those shared tools, make sure you're washing your hands. You know, it's a lot of it you would think is just basic common sense, but it's a pretty long laundry list, you know. So hopefully you won't need a remediation plan, but say you're checking out your job site and for a week it's just a non-compliant. The safety compliance officer cannot get anybody to get back in line. That safety compliance officer can basically shut down the site and say, hey, look, I'm going to tell the controlling contractor or the city entity that we are working for that this job site is not compliant, the job site is shut down, and you need to have a remediation plan in place in case you need to deal with that. So you cannot open up unless all your ducks are in a row. You can't open back up. So they say you need to report this to your designated county official. Now there is a ton of gray area here with the designated county official. At SFO, at San Francisco International Airport, the designated county official is kind of the supervisor that is working for the airport in a certain department. So say someone is the head of design and construction at SFO International Airport, and when there's something happens on a construction site, if there's a COVID-19 case, it gets reported to them. They are actually considered that designated county official. There really isn't a designated county official that I've seen or heard of, and correct me if I'm wrong, that is coming out to job sites in San Francisco and seeing if people are dotting their I's and crossing their T's on COVID-19. So the designated county official, if you work for a city agency, can be the owner, the supervisor, the controlling contractor, or who they're hired by. But this information needs to be recorded and supplied to them if you have a COVID case. And that JSAS that I was talking about that really doesn't necessarily apply to you guys, it was the job site safety accountability supervisor. And the reason why I'm putting it in here at all is because, you know, I want to make sure that, you know, if you think you need the JSAS, let me know, and we can make sure that either that's not the case or that is the case, because that is a huge added extra moment to hire a third-party job site safety accountability supervisor and have them jump through all these hoops like the health orders call for. So usually you won't have to worry about that because of the size of your company, but really because also you work for a public entity. There's a safety compliance officer checklist that I found on a favorite website of mine, and it basically just runs down like, hey, you know, when you're going through your day as the safety compliance officer, whether that be you personally, you took on that role in your company, or you assign that to somebody else, whether that be, you know, it doesn't matter who that person is, as long as they have that OSHA 30 hour and as long as they have that first aid. So you want to make sure that people are washing their hands, entering and leaving the site. You want to make sure that they have the entrance screening buttoned up and all nice and, you know, and tight on that front, especially that job site entrance screening, because that's where all your record keeping will come from for all the workers that come onto the job, and visitors too. You know, you might have those third-party inspectors that need to come on and inspect your job site. They have to adhere to all of this stuff as well. They don't get to blaze by anything, you know, and we've seen people try to do that. COVID-19 exposure, you need to make sure that guys are aware of how that is possible and what to do if they get exposed. Symptoms, report to supervisor, the daily screening protocols that you're doing, those 4 questions that we talked about, the job site rules, and and pre-job site travel restrictions. Now that's a big one because one of the moments that we had at SFO at the airport was guys going against the travel restriction of carpooling, and they carpooled together. And guess what? The whole carload of them ended up with COVID-19. So that being said, you need to really stress to guys. I know a lot of guys, aren't coming directly from the city. And if you have workers that are coming from far away and their buddy is on the way or he lives in the same city, it's really not a good idea to let these guys sit in the same car together for hours and hours at a time when they're potentially exposing other workers. So carpooling is something that you really need to talk about. Sanitization and hygiene procedures, always. Worker feedback and safety and sanitation improvements. Now, I think that this is really important as well because all of these protocols and implementations and safety plans and getting your safety compliance officer on board, that should not be done at a desk behind closed doors. That should also include the workers that are going to be exposed out there in the field. And it's important that those guys also have that two-way street. They also have that safe moment where they can go, hey, boss, this is not up to par, and I don't feel like that this is a safe moment for me. And it's not good for us out there because we need a little help from you on this. Workers that are afraid to speak up in those moments, sometimes they can end up to be the ones that get exposed too much or they get hurt, and we don't want that. So construction site, daily cleaning, sanitation, we kind of already talked about that. Most construction companies are doing that twice a day. They have either a 2-person crew or a 3-person crew or even 1 person you just get to do this twice a day. And they go through and they take care of business. And you can also hire a third party to do that. They sweep around the Bay Area and go to different job sites and are doing nothing but cleaning. We talked about the remediation plan and if you would need the remediation plan or not. Hopefully you would make sure that you have everything in line to where your safety compliance officer doesn't ever have to come back to you and say, hey, this site is just not up to par on COVID-19 protocols. But there won't be any the city won't allow any construction activity if non-compliance happens on your job site. So you can also get in a lot of trouble if the records show that there was non-compliance by the safety officer and you keep pushing and working and then you have some COVID-19 cases, you can get in a lot of trouble and be liable in that position. Repeated non-compliant work is appropriated to job supervisors. Yeah, it's the same thing. Designated county officials, your supervisors that are involved there. These will be available to you guys. All of these resources. This entire presentation will be available to you. But I really love the United Contractors website. United Contractors, they not only have a media center that has different checklists and different templates. Excuse me. They have all kinds of information, and it's usually California based. So I recommend checking that out. Of course, Cal OSHA, they have some good resources as well. There's some CDC guidance down there.